Hi everyone, do you know what? I'm gonna have to change the lighting in here. Give me 1 second. All right, so that's a little bit better. You know what? Hi everyone, my name is Rachel. I'm gonna have to actually go inside because I do not like the lighting out here. I was gonna try to have something outside, make it a little different, but it's a little dark, so let me change it. Give me 1 minute. So hi everyone, this is my house. It's too dark out here. I can't do the video. It's way too dark out there. No one can see. So anyways, I'm just gonna move over here to do our visit. I'm gonna have to do it here. I'm sorry, I have people waiting. I have to do it here. Yeah. So hi everyone, it's so nice to see everybody. I was trying to do our video outside, get a little bit different, but I'm gonna do it over here in our room. So it is so nice to meet everybody. Sorry for the little complication in the beginning. So to start off, my name is Rachel. It's so nice to meet you. And I am a lactation nurse as well as I also work in maternity in the hospital. And I figured it would be a great time to kind of learn from everybody and talk to a few people. So for all of those who are joining now, would you mind just saying where you're from and how many weeks you are? That way it can kind of help out to get to know each other and also kind of get to know what you guys would need individually. So my name is Rachel. I'm from Florida, and I currently am not pregnant, but I have 2 boys. I actually have a 2-year-old as well as a 4-year-old. So they're growing up. 16 weeks as of yesterday, and I'm from Utah. So it's very nice to meet you, Kylie. So I have a bunch of wonderful things that we're going to learn together today. I just wanted to start off, we'll start out a little bit about childbirth, and then we'll go into breastfeeding. I'm not sure if any of you guys have been to my other classes as well, but these were questions that actually were actually submitted that I can answer now together. So for the first question that we had was basically about breathing. So for the people that are on today, I know I have Kylie and a few other people. Are you guys pregnant or is this after delivery? And you guys can type, there's like a little live chat box, and it's a great way that we can just kind of be interactive and learn from each other. And pregnant, awesome, perfect, 16 weeks pregnant. And then whoever else is into can chime in also, but you don't have to, of course. So for the first question that I had, so at least Stephanie is also about to deliver because she's 38 weeks, so that's absolutely fantastic. Is one question that I had was, how do I manage my pain management as I am having my baby, like for complications when I'm actually in labor? So one thing to know is actually breathing techniques. So if you guys have ever seen any of the breathing techniques that we have, they're very, very helpful. And one thing that breathing does is it actually helps the baby as well as mommy. So some people, they actually didn't realize that breathing is not only for pain management, but it's also to help the baby. As if you think about it, if the baby is oxygenated, if mommy is oxygenated, baby will be oxygenated as well. Because what happens during your contractions is as your uterus is contracting, it's actually decreasing the flow of oxygen kind of momentarily to the baby. Therefore, that's when the heart rate will go down. So if you ever heard the monitor and it's beep, 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 and then it's kind of slows down a little bit, that's called deceleration, when the oxygen momentarily has decreased a little bit to the baby. So what breathing does is it actually helps to keep oxygen to mom, therefore keep oxygen to baby. So a really, really quick and easy breathing technique that you can do is you find a focal point. So let's say it's right in front of you. The focal point is your clock, or it's your partner or an assistant. you can find a focal point, breathe in a 4 count, and then breathe out 4 count. 1, 2, 3, 4. Usually it's good to kind of breathe in through your nose 4 count, and then you'll breathe out through your mouth 4 count. Just make sure that you are breathing calmly and also regularly, because the breathing actually helps with the baby as well. So that's why if you'll ever see the beeping start slowing down, or they say, oh, the baby's having a decel or something like that, all it basically is that the baby's heart rate is starting to go down because of the lack of oxygen. So sometimes what they'll do is they'll actually turn you to the side, usually on the left side, sometimes on the right, and then they'll go from there, and hopefully the heart rate goes up and the baby starts oxygenating better. And if you guys have any questions as well, you can ask away, because that's the beauty of a live class, is that we all can be interactive and talk to each other and kind of learn from each other. Also because everybody is different, and what one person's question is not necessarily another person's question, so it's great that we all can work together on this. So what they'll probably do is they'll turn you to the side. They might turn you to the other side. They'll put on also sometimes oxygen through a face mask is usually what they'll do. About 10 liters is what I'll see usually. They'll put the face mask mostly to help moms more than anything, to kind of get that oxygen back up. And then after mom gets that oxygen back up, usually the baby's heart rate starts to rise as well. So anyways, other than that, I did have a few more questions about childbirth. My other question that I had was actually how to get better after delivery quicker, like for postpartum care. What do you do for vaginal hygiene as well as cesarean birth? What to do to take care of yourself and to take care of your incision. So basically, thank you. My husband was just helping me out. So basically, for cesarean birth, you'll have an incision that you have to take care of in addition to the vaginal hygiene. So for the cesarean birth, you want to keep your incision clean and dry. And the way that you can do that, you can still shower after you have a cesarean delivery. It's just the biggest thing is you want to keep it clean and dry. So you can shower, make sure that you're not scrubbing the incision site, but instead that you're patting it when you're taking a shower, and you don't use any of those small little beads, just because especially those small little beads sometimes can actually cause infection as well. And non-fragrances, usually the best, not to have anything with fragrances or anything like that. So you pat your incision site, you can still take a shower. Sometimes they'll close with sutures, sometimes they'll close with something called steri-strips, which are kind of like surgical tape. But that's one thing you can talk to your doctor about as well, is what they use to close that incision site. Do they use staples, which sometimes come off a few days, sometimes a few weeks? And then, or do they use steri-strips? So those are all things that you can talk to your doctor about and see what they do specifically. And then just keep your incision site clean and dry. For the vaginal area, you'll have something called lochia for a while. And lochia, basically, it's kind of like period-like bleeding as your uterus is kind of, cleaning itself, cleansing itself. So you'll see on your pad, either small blood clots are fine, but if you see big, large blood clots about the size of your fist or greater, you'll definitely want to talk to your doctor about that. So for incision site, keep it clean and dry. For vaginal health, you'll keep track of your lochia, see if it's large bleeding or if you have large blood clots. And you'll also want to make sure that you pee like every 2 to 3 hours. That's my biggest kind of help for moms right now, especially who's recovering after childbirth, is make sure that you're peeing every 2 to 3 hours. Because one thing that a lot of people don't realize is that if your bladder's too full, that it will definitely cause you to have more pain. So I know, like, Stephanie, you're almost delivering, and I'm sure you'll start to notice that it gets very uncomfortable as your bladder gets more full. And the more full your bladder is, the more uncomfortable you feel. And then what happens after you deliver is actually a full bladder can actually cause you to have more incision pain, and it can actually cause your uterus to start quivering a little bit as well. So those are definitely some things that you do not want to have after childbirth. But peeing every 2 to 3 hours, keeping your incision site clean and dry, and also keeping your vaginal health also clean and dry as well. So when you go to the bathroom, they'll usually give you like a clear plastic bottle that you can fill with water. You can fill that with water, and then that will help you to have some good vaginal hygiene. I usually recommend to clean off the vaginal area every time you go to the bathroom until you stop bleeding. And it takes anywhere from a few days to a few weeks to stop bleeding. Like for most, it can take anywhere from a few weeks, sometimes even 2 to even 6 weeks sometimes. It took me 6 weeks, but that's because I never stop. I'm always like running around and doing stuff. But if you rest and relax, hopefully it won't take too long for you. And does anybody have any questions about what we talked about so far? We talked a little bit about recovery and all of that, but if you have any questions, you of course can let me know. So for recovery, we talked about hygiene. Another important thing is making sure that you are up and moving and walking, that you're not just in the bed all the time, because that's another thing that a lot of patients I'll see is that they're in the bed and then they're like, oh, I just had the baby, I shouldn't really move. But that's kind of the worst thing you want to do after you have a baby. You want to be up, you want to be moving, you want to be able to be active. It's also for circulation, because if you're just sitting there, you're not really moving that much, and your blood is not circulating, you'll be at a much higher risk of blood clots, especially in the legs. So it's definitely very important to try to get up and moving. After C-section, you'll notice that usually your anesthesia is in your system for about 12 hours. Usually they'll hopefully get you out of bed, and then they'll take out the catheter that's draining your urine. So hopefully it'll be that time, as long as you're filling up to it, that after 12 hours, usually it's a good time to walk around, get out of bed. And you don't have to do too much, like don't have to run a marathon or anything like that, but it's a good time to be able to walk around, get that circulation. And then another great tip that I have to help you recover is also to change your clothes. Not a lot of people realize that you actually can change your clothes to get out of the hospital gown. Is there something about being in the hospital gown that kind of just makes you feel like you're a patient or like you're an old man? But being out of the gown into your own clothes really, really kind of helps to change things around and gives you a different perspective and different mentality. So number one, the biggest key to recovery was going pee like every 2 to 3 hours, try to pee. Number two is try to walk, ambulate, get out of the bed, change your clothes, freshen up. That's very important. Number three, my third biggest key is try to drink lots of water. So if you are a mom, which you probably are because you're watching this stream right now, number three is drink a lot of water. But the thing is, if you are a mom, you probably don't think of yourself that often. You probably think more of your baby more than anything, which is fine. You're a mom. So what I do to kind of remind myself to drink water, and I tell my patients about as well, is every time you are feeding the baby, drink a glass of water. So like, let's say your baby has to eat 8 times a day. What you can simply do is have a glass of water as you are feeding the baby, and then that will be a good little indicator to drink more fluids. So for those of you who are watching, I want to test your memory and hopefully get you guys a little bit more excited. Like I'm excited for class. So you guys, if you guys can please tell me the 3 keys to recovery after postpartum. So any of you guys can say any of the 3 keys or all 3 keys if you want, just to just make sure that we are listening, paying attention, and you also can watch this video after as well to kind of remember all the stuff we talked about. But we talked about 3 keys to recovery that are very, very important after you deliver. And we talked about the first one was going pee. Trying to pee like every 2 to 3 hours, because if your bladder's too full, it presses against your uterus. Number 2 was walking, ambulating, trying to change out of your clothes, out of the gown, get into your own clothes. Exactly. Exactly. Get up, move, water, pee. Exactly. And drinking water will definitely help. Yes. Drinking water also helps because it kind of helps to flush out, everything that was going on. So it's a great thing to be able to drink water. So, and actually, I especially mentioned that because me personally, I actually had to be admitted with my first baby again after delivery because of dehydration. So that's why I especially mentioned drinking water coming from somebody who did not drink enough water and was constantly breastfeeding and pumping, and I was losing a lot of milk and I really was not putting anything back in. So that's why I especially mentioned drink a lot of water. So does anyone have any other questions about childbirth? And I have some more questions here about baby care and about breastfeeding. Oh, I actually just had an email with a question. Can you drink too much water? My doctor is just talking about not drinking over a certain amount of mLs during pregnancy. Kylie was asking if you can drink too much water. Now, the biggest reason that I'll notice people say to kind of limit the amount of water that you're drinking is because of blood pressure issues. Kylie, do you have any issues with your blood pressure that they were mentioning maybe? But usually the average is that you would want to have about 8 to 10 glasses of water. But if you have problems with your blood pressure, you'll be a little bit more on a water restriction, is from what I've seen as well, where we'll try to limit the fluids that are, the IV fluids, and we'll try to limit the fluids that you're intaking as well. So all of those are different things to notice. But usually 8 to 10 glasses is good, but you can always have more, as need be. So I just had another question as well that was emailed. How do I know if something is off either during pregnancy or after delivery? I'm a big proponent of mom's kind of senses, mom senses. When mom senses something's off, listen to your senses. Especially as a nurse, I would much rather you come to the hospital and everything be okay than not come and something not be okay. So whenever you have your mom sensors are tingling, especially during your pregnancy, so they especially were asking, how do I know if something's off during pregnancy? So the telltale signs too that you would want to look to come into the office or come into the hospital. Number one is if you're having regular and intense contractions, and especially if you're early. So regular intense contractions is more of a sign of true labor than irregular and kind of non-intense contractions, especially if you are premature, especially if you're under 36 weeks. Another is if you have any bleeding. Any bleeding during pregnancy is definitely something that you would want to talk to your doctor about. And then especially if your fluid ends up breaking, like let's say your water breaks and it has any foul odor, anything like that, you definitely would want to tell your doctor about that. As to something off after delivery, the biggest things you're looking out for, number one is hemorrhage. So remember we were talking about different signs that your lochia or your period-like bleeding after delivery is too much. What were some signs that your bleeding is too much? So let's say, how would you know if a blood clot was too much? What would you guys say? But there's a few different signs, but that's one of the most important things that you would want to know if you're having a baby, is what to look out for in terms of your bleeding. Now, normally when you have a peri-pad, which you would want to change every few hours, but if after 1 hour your pad is soaked, that is considered heavy bleeding. So usually you'll say about 75 to 100% of your pad, if it's soaked in an hour, that's considered heavy bleeding. And then number two is if you have a blood clot, like the size of your fist or bigger, that's also a sign of heavy bleeding. So those are things to know if something is off. And then another is blood pressure. So signs of your blood pressure being elevated, which can happen after delivery, especially as all of that fluid that was in your uterus is now going to your circulation. So one way also to tell if you're having blood pressure issues besides obviously following up with your doctor's appointment, is dizziness. If you have dizziness, blurred vision. But the thing with blood pressure also is that it's kind of a late stage that you'll find out that you have blood pressure issues, because by the time symptoms come up, it's usually when your blood pressure is very, very high. So you would want to continually, if you have blood pressure issues during pregnancy, you would want to make sure that you are checking your blood pressure continuously after delivery as well. So if you're on blood pressure meds, I usually recommend to check your blood pressure before you take the medication as well, just to make sure that you don't bottom yourself out. And then, of course, mommy senses, that's the biggest thing for mommy senses. Do I have any questions about childbirth before we get into my baby care questions that I had for today? And then if you guys don't have any, that's cool. I guess I'm just that great of a teacher. So my baby care questions, that's kind of like a tongue twister a little bit. So my first one was about when can you trim the nails of a newborn. So I had a lot of questions about baby care actually, but one was about the nails. So one thing you'll notice is that babies have long nails when they come out, and not a lot of people realize that as well. But when the nails come out, you don't want to trim them yet with a nail clipper. What you can do is you can actually file the nails, and then that is a lot safer because their skin is very, very, very soft. So you can trim the nails if you want, just don't clip them, because you can clip the tips of the nails instead. And it's actually, if you think about it, they still have those long nails inside the womb as well. So it's not like they come out and all of a sudden they have long nails. So the same amount of nail length that they have inside, they're having on the outside as well. And it's actually, I noticed some people wear gloves, but actually gloves are not really recommended for newborns. If they're the gloves that attach, like some pajamas have attachable gloves, those are fine. But if it's the gloves that detach off, they're actually choking hazard. So that's why it's important. You can have the attachable gloves that, if you're afraid of them scratching their face overnight or something like that, you can have the ones that are attached to the pajamas, but you don't want to have the ones that detach off, especially because if you notice a newborn, once they start sucking on their hand and they go, it's kind of like a craze that goes on. And then babies have actually choked from mittens. So you don't want to use mittens. And actually when you're breastfeeding, you want to have those hands open, and that kind of goes into my breastfeeding kind of section a little bit as well. But you want to have the hands open while you're breastfeeding and actually touching the breast, because as the baby's touching the breast, it actually is helping to release hormones like oxytocin, because that breast compression from the hands are actually releasing oxytocin, which is your milk letdown hormone, and that helps with the breastfeeding process. So it's very, very helpful. All right, I was just looking at another pop-up question I had. All right, so actually that's another thing that a lot of people don't realize, is that the skin on the hands actually helps a lot in terms of breastfeeding. And then anybody else had any questions about in terms of baby hygiene or baby baths, anything like that? I had a few questions about swaddling a baby, so that can be my next section, but if not, all right. I'm going to get my baby, and don't mind my house in the background. I am a mom of 2 toddlers and a husband, and sometimes the husband can even be more work than the toddlers. Give me 1 minute, I'll be right back. All right, so I wanted to show you guys how to swaddle, and I wanted to show you guys some things that I noticed as well in regards to swaddling a baby, and blankets that you should use and blankets that you should not use. So for today, I do not have little babies anymore. I have a 2-year-old and I have a 4-year-old. So I'm going to use my baby's tiger as the baby for today. I think he's cute anyways. So one question I get a lot is, what types of blankets should I be using for a newborn? Because I see a lot of people, they'll have these fuzzy blankets, you know, like they'll have the fuzzy big blankets because they're like, oh, the baby's going to get cold. I completely understand that. However, blankets like these are a big no-no for a newborn. Don't put them in the crib. Don't really put them in the nursery. When they're a little bit older, you know, that's okay. But newborns, you want to have thin blankets. And it's very important too that you are listening to the source of who's telling you this information. Because I see a lot of YouTube channels, honestly, that will tell you advice about babies, and they'll have very scary sleep situations. So be very careful of who you are listening to in terms of sleep situations and baby situations, okay? So for one, you want to have a nice thin blanket that does not really have a lot of texture to it. You don't want to have that much fuzz, you know, so that they're like walking around. Here, let's put this. Kind of a boring background, but at least there's not dishes and people walking around in the background. I have a family. Can you imagine that? Anyways, so what I was saying is these fuzzy blankets you do not want to use. One is that it does not circulate oxygen very well. It just kind of recirculates carbon dioxide. So that's one thing to realize, is don't use these fuzzies. Another thing is that a lot of the babies have allergies. You know, if you think about it, it's a very allergic kind of material. So babies, they'll tend to have very sensitive skin in the beginning. So if their skin is very sensitive, and then you tack on this very fuzzy blanket, of course their skin is going to start breaking out and being a lot worse. So we have our nice, thin, appropriately sized blanket. You don't want to use like a big toddler blanket or anything like that. Now what I'll do to swaddle is, so let's say you have your blanket like this, which has 4 corners, okay? So what I'll do is I'll fold a corner over like this, and I'll make a triangle. This is the tri-fold method, okay? Then I will lay the blanket down. Here, so I'll show you how it works. So you'll lay the blanket down, okay? And then the head of the baby is a little bit above. The shoulders will be a little bit below, okay? Then all you're gonna do is you're gonna do the side like that, okay? Then you're gonna do the bottom, and then you're gonna do the other side and fold over. So, and then that's how you make your little swaddle. So it's just the side, then the bottom, and then the other side. Do I have any questions about the blankets or the swaddling or anything like that? I know that there's so many questions when it comes to new babies. All right. So for swaddling, just always make sure, especially for newborns, that your baby's nice and warm. I usually like to have 2 layers on our babies. So that really has, so how long can they stay swaddled? We swaddle babies in the hospital. We'll swaddle them we'll try to do skin to skin as much as possible, but let's say mommy's tired or daddy's not available, mommy's not available. We can swaddle them, and I usually swaddle them in 2 layers, just so that at least they're nice and comfy and that they don't have their chest exposed. And then they can stay swaddled for, pretty much as long as they're comfortable. What I did was I transitioned from the Swaddle Me to the Halo Swaddle. It's like a sleep sack, and that was actually very nice for us. And we transitioned to the sleep sack about 2 months after delivery, so that was actually really helpful. So we used the Swaddle Me that kind of has that little Velcro piece that you put along, and then the sleep sack we were able to use after that. But babies love swaddling, just because they love the position. They love to, have everything kind of close by, just like how they were in the womb. So swaddling definitely helps with that. Do I have any questions about swaddling or anything else in that nature about blankets? Then my other question was about parenting two kids. So I had somebody who actually is going to have their second baby, and she asked me, so what are some tricks for having two children, going from one child to two babies? And how many of you guys actually are on your second baby? So let's say you're pregnant, you already had your first baby, and now you're going on your second baby. And I know that there can be a lot of challenges as you introduce another baby, but I love having two children. It's so nice to be able to have them together, that they can play with each other, that they can occupy each other. And now they're like best friends. So 2 and 4 is like perfect age for that. But some things that I've seen that really, really help. Number one is that which actually was such a cute idea, was some people actually have like a gift from the baby to the sibling. So they'll actually say, Mateo, for example, he really loves race cars. So I've actually had people buy like a race car set and say, oh, this is from, baby Nathan, or this is something new in the room. Oh, this is from, baby, whatever. So actually by having them have that present given to them, they're like, oh, okay, that's so nice of my baby brother, my baby sister. And then number 2, which is very important, is also to think about how you are talking to your other child when you have stuff to do with your new baby. So that comes in terms of, let's say you're breastfeeding your new baby, and your toddler comes up and wants to play. Now, your toddler will not really understand, hey, mommy has to breastfeed her baby, give me a minute. But they do understand it. In their mind, they're thinking, oh man, I want to play with mommy, but she is with the new baby. And then that can cause kind of conflict and struggles in your house. So what I did was, instead of kind of turning the baby away, what I did was kind of involve them in the process to the best of my ability. So, for example, we had some books to the side, and I would say, hey, Mateo, he would come in as I'm breastfeeding Nathan, and Mateo would say, oh, I want to see the baby. So I just had some books there to the side. I'm like, why don't you read to the baby as mommy feeds baby Nathan? And that was something very small that we were able to do together, that he was like, oh, okay, baby Nathan is here, but he's not taking over mommy, we can work together on this. So that's very good for, even if this is your first baby going to your second, is that you do not necessarily need to divide your time. You just kind of learn how to manage your time, that you can, now you just had one, now you have two. And then you can just kind of figure out how both of them can come together, in that situation. So for me, it was a little difficult in the beginning, but once you get your handle on things, it's much, much better. Now everyone's wondering when we're having a third, but 2 is plenty for right now. Now, my next set of questions are in regards to breastfeeding. So how many people are planning on breastfeeding? And you can just say if you're planning on breastfeeding and what your goal is. Are you planning on breastfeeding just for a few days until you go back to work? Are you planning to breastfeed for a year? Are you a master breastfeeder and this is your 5th baby breastfeeding and you never stop breastfeeding? Everybody is different, but everyone has different goals too. That's the hope. Not sure how long since it's my first time. Exactly, Kylie. I mean, what helped me was making short goals instead of saying I'm going to breastfeed for a year, which in my mind was the final goal, that I wanted to breastfeed for a year. I started off with small goals. I'm going to make it to 3 months, then I'm going to make it to 6 months, and then I'm going to make it to 9 months, and then by having those small goals, I was able to kind of manage my time more realistically. And just by, okay, I met my first goal. I did 3 months. Good for me. Pat on the back. The first couple of weeks are hard, so small goals will make it hopefully less stressful. Exactly, Kylie. So that for me was better because it's more realistic. And actually with my first, I didn't really know that much about lactation. So I did breast and formula. I did both of them from the beginning. I was a maternity nurse at that point, and that's one thing that some people might not realize is just because someone's a maternity nurse does not mean that they're an expert on breastfeeding. I had been a maternity nurse for some years already, but I didn't really know that much about breastfeeding. So my baby was on shallow. Now looking back on it, I realized that he was not really latched on that well. I just assumed that he was because, he was on, I'm like, he's sucking. Doesn't that mean he's breastfeeding well? But as a matter of fact, looking back, he was not really latched on that well. He was not breastfeeding that well. I did breast and formula. And I know that some people, that is your goal, and that's perfectly fine. If your goal is breast and formula, that's beautiful. If your goal is breast, I can help you as well. So it all goes with whatever your goals are as an individual. So for me, my first baby, I did breast and formula. Then my second, I actually was able to exclusively breastfeed for the full year. So pat on the back for me. At least with my first, I did breast and formula for 1 year. So it is possible to be able to do combo feeds. If that is your goal, to combo feed, you can do that. And your milk supply will not necessarily dwindle down to nothing. It's just your milk supply will be appropriate to your demand that the baby has. So for example, let's say your baby is feeding every other feeding breastfeeding. Your milk supply will be kind of relevant to how much the baby's stimulating. So if the baby is stimulating every 4 hours, your body's going to think, okay, maybe I have to make milk every 4 hours. And it kind of goes with that. So for the first couple of weeks, it's kind of difficult because the main reason it's difficult is because your body is kind of learning how to maintain its milk supply, kind of build up its milk supply as well. And it kind of goes up and down and up and down. In the beginning, you'll have colostrum, which doesn't really come out like pouring as much as you would see in the videos. It kind of comes out with like small little drops, and then moves on from there. The more you stimulate and breastfeed, the faster your mature milk will come in, and the more satisfied that the baby will feel kind of after, and also you'll be able to hopefully go longer stretches without feeding. Just in the beginning, it's perfectly normal for babies to want to feed very, very, very frequently, especially because breast milk is very easily digested by babies. So as the baby's breast milk is easily digested in the stomach, what you'll notice is sometimes a formula-fed baby might go 3-4 hours without eating, and they're perfectly content in between. While a breastfed baby in the beginning might, be on the breast, they're content to go to sleep for 30 minutes, and then they want to start feeding again. It's just the breast milk is very easily digested. And plus, babies that are breastfeeding also comfort themselves on the breast. They use mom not only for nutrition, but they also use mom for comfort. So that's another thing to also realize as you are starting your breastfeeding journey, is that, these first few days are stressful. And I do have a lot of resources. I know that we have a few people on here. I have a lot of resources on my website. I do have on mommydidyouknow.com. You'll see everything. And also on the description of this video, I have a bunch of resources. I have a breastfeeding class, I have a prenatal class, and I also have consultations. So I have some consultations that are like a quick, 30 minutes, teach me how to pump, or quick 30 minutes, hey, is my baby latching on correct? Or you can have an hour. And then I even have up to 2-hour classes that are basically like a childbirth, all encompassing 2-hour private, just me and you, and we can do over Zoom. So if you wanted to schedule those or you have questions, you can always see on the description. You'll see all the consultations for private classes and all that good stuff. Because I thoroughly enjoy teaching. That's like one of my biggest passions is teaching. And I think that's why I love postpartum so much, because I mostly work postpartum because that's where I do a lot of teaching. And it's really, really helpful. So anyways, so one of my questions also was about pumping. And how early should they start pumping and how they should pump. So I know that we have a few people that are breastfeeding, and sometimes we want to pump in addition to that. Now, the biggest thing with pumping is the reason for pumping in the beginning is for separation. So let's say mom has magnesium, her blood pressure is running really high, she's on magnesium. You might end up being separated for the baby for some time, or even in the NICU. And then if you and baby have any separation in the beginning, within the first 6 hours, you would want to start pumping. However, the first 3 hours is maximum if you can, but definitely by the first 6 hours, you would want to start pumping after separation. That just helps to stimulate your milk supply because the baby's not on the breast. So you have to tell the body that message, like, hey, let's start creating milk. I'm gonna stimulate in kind of in the way of the baby, because the baby's not stimulating directly. Let me use the pump to do that. And then one thing that's very important too is while you're pumping, be effective in your pumping by actually massaging. I see a lot of people, when they pump, kind of hold the pump like this, and then they just let the pump do its thing. But if you think about it, babies are not just stretching the nipple. Stretching the nipple just releases a little bit of oxytocin, the milk letdown hormone. But babies are also compressing, as they are on the breast. They're not just stretching the nipple, they're actually compressing the breast. So if you truly want to simulate a pumping experience as the baby would actually have on you, you would actually want to compress the breast as well with your hand. So what I'll do is I'll actually kind of take my thumb, especially if you have clogged milk ducts. It really, really helps. You can use your thumb in a circular motion, move your way down. You'll probably get clogged milk ducts a lot kind of underneath your arms. I'll notice you get clogged milk ducts. So then you can actually do in kind of a circular motion, make your way down, and then you can actually take your hand and stretch all the way down to compress the breast just like the baby does, because it's all stimulation just like the baby. So for pumping, the key to pumping is not just nipple stretching like the pump will do, but it's also breast compression just like the baby does. So you really want to have a similar experience. And then what breast pump do you like or recommend? That was my question right now. So for me, I use the Medela pump with both of my babies. We use the Medela InStyle Advanced. So I purposely like Medela. Personally, I like Medela. But the Spectra is also very good. I've seen very good. And then how can you tell when you have clogged milk ducts? So for me, I used to have very clogged milk ducts underneath my arms and right in my my inseam in here in the breast. What you'll see is you'll have a hard ball that doesn't go away with just one feeding. It's usually hot and it hurts and it does not really move around. Okay, that's the biggest thing. It's kind of just like a hard ball in your breast. So what I'll do is it usually takes a few pumping sessions to get out. If you're breastfeeding with a clogged milk duct, make sure to breastfeed that side often. And keep in mind too, that different breastfeeding positions actually empty different parts of the breast. So for example, cross cradle, which is when the baby is, a lot of people kind of do the cradle like this, but if you do the cradle with the belly to belly, that's good. But I personally like cross cradle for newborns. That's when you have the baby's forearm here. So your forearm is here supporting the baby's back, baby's belly to belly with you, and then nose to nipple, and then you can put the baby on. This is very, very good for clogged milk ducts on the axillary region. So if you have clogged milk ducts here underneath the armpit, this is a great way to kind of get those clogged milk ducts out. Now, also, there's another one that's very good is football or the clutch hold. So this is very good where the baby's kind of towards you over here. The feet are inside your arm here. And then what you're doing is you're actually kind of holding like a football, holding a nice support over the head, and then the nose to nipple, and you can latch the baby on this way. This is a very good way to get clogged milk ducts out from the inner breast. So if you're having clogged milk ducts on this side, this is a great way to get those out. Then what I'll do is I'll actually go like this in a circular motion, and then you can get those milk ducts out that way. So that really, really, really helps. And then for breast pumps, I like the Medela worked very well for getting those clogged milk ducts out for me. I did try to use a Mita a little bit. I've heard good things about a Mita, but I noticed that Medela was the best for taking out those clogged milk ducts for me. I just feel like it was a little bit more effective. And then I also used the Medela hand pumps as well. The hand pump, what I would do is I would actually like kind of stick it in my purse in like a little baggie. And then I would just take it with me, so if you're going to the restaurant, you're going wherever, you could just have a little bag with your hand pump. And then it's very easy. You can even do it in the car. You have your hand pump and then you can pump in the car, do whatever you need to do with that. And then that was just very effective for me. I actually went back to work 6 weeks after having my baby with my last baby. So pumping was very important and it was an essential part of my breastfeeding experience, especially with Nathan when I had to go back to work so early. So what I did was I would just pump every 3 hours while I was on the shift, which, it's difficult at times, especially I would try to breastfeed before I left for work. So let's say I was leaving at 6:30 a.m. I would try to breastfeed like from 6 to 6:30, at least so he can empty the breast effectively. And then I would have my pumping session again, every 3 hours. Every 3 hours I would pump that way, and then I would pump for about 15 minutes. And then that really helped for me. And then there is such a thing, by the way, as exclusive pumping. So some people, they've been asking me a lot. This was actually another one of my email questions. And I know probably some people would be watching this video after. But one question that I had was exclusive pumping. What is it? How effective is it? And is that for me? So exclusive pumping is basically when you are not putting the baby directly to the breast, you are instead pumping for all of the feedings instead of putting the baby directly to the breast. Usually that's because sometimes moms, that's just the way that mom's routine works. She would prefer to be able to kind of schedule herself like that. Or sometimes the baby has a hard time latching, or sometimes there's abnormalities with the baby that would make direct breastfeeding difficult, or, whatever have you. Some moms, that's her decision. So exclusive pumping, the key with that is you cannot skip feedings, because you would want to not only have the nipple stretching, but you would have the compression, and you would want to feed just as often as you would be feeding the baby. You would also be stimulating the breast with the pump. In my opinion, exclusive pumping is a lot harder than direct breastfeeding. Just because with exclusive pumping, you also have to clean the materials off, you have to clean the supplies, you're spending time pumping, and then you're spending time feeding. So it's kind of double the work. I know that some people do pump at night and then they'll breastfeed during the day, just because I guess sometimes they like to give somebody else the chance to feed the baby. That's fine if you do that way. It's just I find also that if you're pumping at night, it actually takes more time, because if you think about it, you're taking the time to pump, then you're taking the time to clean the parts, and then you're taking the time to feed the baby as well. So it's all up to you and what you like to do. Or you always can, simply pump, hand the bottle off to, whoever the partner is, your support person, and then they can feed the baby for you that way. But it's all up to whatever your plans are. And I do have breast sizes as well. So if you wanted to schedule any consultations with me to go over how to use your pump, or to see if your pump size is correct, or to change anything, I can always do those consultations as well. So I have on the description, it has all the information in that aspect. Do I have any other questions about breastfeeding or baby care? I was just looking. I had another question about weaning that we can go over, but it seems to me like most of you guys are pregnant from what I've seen from the comments. But for those of you who do plan on weaning in the future, one of the questions that I had was, how do I wean a baby off of the breast? And is it something that I can start, or do I have to wait for the baby to start in order to wean the baby? Weaning is basically taking the baby off of your breast milk and putting them on another nutritive source. So that can be weaning off the breast and onto formula. That can be weaning off of the breast and onto solid foods, or weaning off the breast and onto, let's say they're a year old and they're feeding regular food. So the key with weaning is to take it slow. You don't want to do too fast. Usually changes take a few days to take place. So I would say once you're ready to wean and both you and the baby are ready, I would take changes slow. So you would start off, let's say you feed 6 times a day. The breast, I would say, take one feeding off at a time, see how that works, wait about a week, and then you can cut down another session. So just by taking off one session at a time, it really, really helps to kind of make that transition not so crazy. And keep in mind too that changes for babies are very, very important. You want to keep those in mind as well, because you don't want to have too many changes at once. So let's say you're changing houses and you want to wean the baby off. That's a lot of change at once. So what you would want to do is, if you're changing houses, wait for a week or so for that baby to get used to those changes. And then after that, you can try to wean, or, vice versa, just because babies, they usually take changes slower. It's much, much better. So those were pretty much the questions that we had for today. And I do have other questions as well. And I have, other Q&As on my channel as well. And I will be having additional Q&A sessions as well that you can always sign up for. And I just wanted to know, for the people that are in the class now, what was the most important thing that you learned today? That's just a good way for me to know what people like to learn, what people maybe did not know before. So maybe if there was something that you did not know that now you know, or you feel more confident about, what was something that you learned that was special? And then, of course, you can always look on the description for all of the resources that we have. And I have so many amazing resources, and I hope that we can continue to connect and learn from each other and be there, and just know that I am here. I will continue. I'm working hard now with my YouTube channel. I wasn't really working on it for a while, but now I'm working on it. I found that it's a good resource for people. So I'm hoping that this was a blessing for you guys, that you learned something. And if you guys have any questions, you can also email me at mommydidyouknow@gmail.com. That's my email address, mommydidyouknow@gmail.com. And you can email me anytime you want. I really thank you for your time. I know that you guys have a lot going on, especially during the holidays. But I wish you guys all the best, and thank you so much for watching. And I hope to continue to learn from each other. You can always subscribe to, like the video, grow this program, these resources, and I hope to see you all very, very soon in consults or whatever have you, other classes, all that great stuff. Have a wonderful, wonderful rest of the day, everybody, and happy Thanksgiving, happy holidays, and I wish you all the best.